Hello, my name is Baylor Manier, and today I'm going to be talking about epicondylitis, or more specifically, golfer's elbow, which is medial epicondylitis. My goals for this video are going to be to discuss what golfer's elbow is, different ways to treat it, how it's caused, and as well as going to talk about preventing golfer's elbow. And then finally, I'm going to discuss the stretching routine that I've created for my patient with this condition. First off, what is golfer's elbow? Golfer's elbow is a form of tendinitis that affects the medial tendons of the elbow that connect your forearm muscles, the flexor forearm muscles, to the bony protrusion of your elbow. Golfer's elbow is similar to tennis elbow, which I talked about in my previous video, which occurs on the outside of the elbow. Golfer's elbow actually occurs on the inside of the elbow, the medial side, but it's not limited to golfers. Golfer's elbow can happen in baseball, can happen in tennis. Any sort of throwing action with the arm can ultimately form golfer's elbow. The pain can extend all the way through the forearm into the wrist and even up the arm as well. Golfers and tennis players, athletes in general, others who repeatedly use their wrist or clench their fingers can develop this form of tendinitis. The pain of medial epicondylitis or golfer's elbow doesn't have to keep you away from the course or out of your favorite activities. Rest and appropriate treatment can get you back into the swing of things with no issue, and that's something that I'm going to talk about with my treatment later on in this video. But for now, I'm going to discuss the different grades of medial epicondylitis and their different symptoms and how they affect the patient. So with grade 1, it's the mildest form of epicondylitis. You're going to have general achiness, pain's going to occur during activity, but it's going to slowly disappear afterwards. Grade 2 it becomes a little more severe. Pain becomes more pinpoint. You're going to be able to tell exactly which spots on your arm are hurting. You're going to have continuous pain and tenderness due to edema, which is going to be the buildup of fluids in the arm and the tendons, the surrounding muscles. This is the body's form of healing, and without proper treatment, the body's process of healing is extremely slow, and there are different things that we can do to aid that process along. You are also going to feel possible tingling and numbness in the pinky and ring fingers. This can become problematic because if it becomes too severe, it can lead to eventual nerve damage or permanent damage to the tendon and or muscles. Grade 3, we're moving into surgery, is going to be probable, as most of the tendon has completely torn or ripped apart from the bone, and it's going to have to be surgically repaired. Pain and swelling are now causing permanent damage, and weakness in the tendon and muscles is obvious. Here I'm just going to talk about some of the symptoms that you might see that would persuade you or cause you to go in to see a physician or a physical therapist or even your doctor. Pain and tenderness is usually going to be felt on the inner side of your elbow. The pain sometimes extends along the inner side of your forearm, and your pain will typically worsen with certain movements, more specifically flexor movements of the wrist. You're going to feel stiffness with your elbow, mobility, trouble with mobility, that sort of thing. Weakness is another symptom, with just weakness in the muscles, the hands, the fingers, as well as numbness or tingling. If you feel any of these, it's best to go see a physician just to be sure that it doesn't progress into any further injuries. Now moving on to my patient who has come to see me. Her name is Haley Tippett. She's a 32-year-old female who came to me with the chief complaint of her elbow has been killing her the past couple of weeks, and it will just not go away. She's tried icing and resting it, but it just keeps coming back. Upon further examination, I discovered that she had uncomfortableness and slight pain with certain movements in the right medial elbow, which is where the tendon connects the forearm flexor muscles to that bone. and she also has tenderness and pain when touched and during physical activity. This is problematic as most of your day-to-day activities actually include the flexor muscles of the forearm, such as writing, turning doorknobs, or even moving objects. And she has increased pain with flexion of the wrist. The assessment that I gave her, I diagnosed her with grade 1 medial epicondylitis. And the plan for her is a routine of stretches that I've hand-selected that will be performed in and out of the clinic that may hopefully speed up her recovery process and have a full recovery provided that all the stretches are completed in and out of the facility. So here are a list of stretches that I've provided for Haley. The first one up on the list is an ice cup massage. I've included this one in actually a lot of my videos because it's just such a great exercise to do. It increases blood flow, increases circulation. It's going to provide you with a faster recovery because you're going to be getting oxygen and nutrients to the tendons and the surrounding muscles, and it's going to promote their growth and strengthen those muscles and tendons. The next one on the list is another massage, actually. It's a flexor muscle massage. And what this is you're going to take two of your fingers and you're going to place them horizontally to the course of the fibers in the forearm. So as the forearm muscles and tendons run the length of the forearm, you're going to run your fingers across the forearm. And you're going to apply as much pressure as is comfortable. But you're going to want to get deep in there, and you're going to want to move those tendons and break up those fibers because with an injury like this, such as golfer's elbow, it's going to be very tight. All those tendons, all those muscles are going to be very tight, and you're going to want to loosen them up before you move on to any other stretches. So the next stretch I've provided for her is a pronation and supination stretch. And as you can see in the picture that I've provided, he's actually using a pin to help assist him with this stretch. A pin is great to use if you're starting out with this stretch, as your tendon's going to be very sore, extremely tender. But as you move on and you progress with your recovery, I would move on to something heavier such as a hammer. And what you're going to do essentially is you're going to hold the pin or the hammer in your hand and you're going to hold it out with your palm facing up. You're going to start in this position and you're simply going to rotate your hand so that the hammer or the head of the pin is going to be facing internally towards your body. And then you're going to move it outward to where it's facing away from you. And you're going to do this 10 to 15 times depending on how severe your injury is, and I'll provide you with a number of reps depending on how severe it is. In her case, I believe it was 10 to 15 reps was ideal for her. So moving on to the next stretch, we're going to be looking at the weighted leaning stretch, which is, if you look up in the right hand corner, this is what you will see. In this picture, the gentleman is actually performing the full stretch. This is the maximum stretch that you can get with this certain exercise. The way to accommodate for an injury would be to point the hands, the tips of the fingers away from the body rather than towards. And this is going to provide you still with a stretch that's good enough for your tendons to heal, but it's not going to overuse them or overextend them. And then finally, last but not least, we're going to go with weighted wrist curls. If they cannot perform weighted wrist curls or they're too stressful on the tendon, they're causing pain, we're going to just do normal wrist curls with nothing. And then we'll progress eventually into weighted wrist curls. This is going to strengthen up the muscles of the forearm, which will take less work off of those tendons in the medial forearm. And this is going to conclude my presentation over golfer's elbow. Thank you guys for joining me, and goodbye.